No discussion of a new initiative would be complete without talking about money. So what are the costs involved? And here to do that for us is the Honorable Dr. Oburu Oginga, the Deputy Minister of Finance from the Republic of Kenya.
Thank you, Madam Chair. Now, I come from Kenya. I come from western part of Kenya. The film which was shown here was actually showing my own home. That is where I come from. And I come from a tribe called the Luo. And my tribe, Luo, do not circumcise. And when the topic of circumcision was introduced, I was there as one of the leaders, and scientists came up and proved to us scientifically that circumcision of male reduces the possibility of occurrence of AIDS by 60%. And I stood up there openly and declared that next week I'm going for circumcision. And it was very awesome to the elders because it was a meeting organized for Council of Elders. And they were quite surprised. And because in my culture, if a circumcised male comes to your village and exposes his male organ to the heavens will be so disturbed that there will be no rains. That is what they believe, and therefore introducing that topic. But however, Madam, that was not my, my side. I would have preferred to wear that kofia more than this other one. Because this one, well, I would first of all like to thank the organizers of this forum. And secondly, I also want to bring the greetings of the Prime Minister of Kenya, Honorable Raila Odinga, who has been a champion of male circumcision in our country. In fact, he is a presidential candidate in Kenya, and male circumcision has been one of the topics. Actually, he has been described by those tribes who circumcise, and they are the majority in Kenya, that he is a small boy because he has not been initiated. But now that my tribe has adopted circumcision, I'm sure he's quite relieved because nobody knows what is inside his trousers, whether he has also been circumcised. So I think this is something which is very, very positive in our community. I also, this evening, I shall speak about economic aspects of HIV and voluntary medical male circumcision, using Kenya as an example. Kenya has achieved remarkable social and economic progress over the last decade. Life expectancy and literacy rates are firmly on the rise. Poverty and child mortality rates are dropping. These achievements are the results of the effective growth and poverty reduction policy pursued by the government since 2000. This is embodied in the ambitious Vision 2030 that sets out the course for Kenya to become a middle-income country, providing high-quality life of its citizens by 2030 in a clean and secure environment. To achieve the Vision 2030 goals, many challenges have to be overcome, one of which is HIV/AIDS. With an HIV/AIDS prevalence rate of 6.2%, 1.6 million Kenyans living with HIV, and 110,000 new adult and child infections every year, Kenya is hard struck by the epidemic. HIV accounts for 15% of under 5 mortality and 20% of maternal mortality in Kenya. In addition, HIV is by far the largest cause of adult mortality in Kenya, accounting for 29.3% of deaths. The assessment of the socio-economic impact of HIV and AIDS on key sectors in Kenya, carried out in 2006, confirmed widespread evidence of the detrimental effects of HIV on the economy. Per capita output is estimated to be 4.1% lower because of HIV across the entire economy. The total HIV/AIDS related loss to Kenyan farms was estimated to be US dollars 320 million in that year. These results tally with the evidence found in other countries. However, as of 2010-2011, an estimated 81% of funding for the response to HIV comes from international sources. The vast majority, that is 93%, is from a single source, that is the US government's Presidential Emergency Plan for AIDS Relief. It is therefore particularly worrying that some donors have recently indicated that they want to stabilize and subsequently decrease their contributions to the AIDS response in Kenya and elsewhere. That is why this panel is important, so that we can collectively agree to make hay while the sun is shining, but also commit to ensure that our HIV/AIDS responses are cost efficient. Any efficiency savings will directly reduce the AIDS financing gap. One way of improving efficiency is to implement interventions like male circumcision that are high impact with excellent value for money. The unit cost of VMMC ranges from US $65 to US 95 per VMC performed based on a cost assessment of VMMC services aligned with the World Health Organization's considerations of models for optimizing volume and efficiencies. In Kenya and during VMMC's campaigns, we have managed to bring this unit cost down to $30 US. On the other hand, per patient ARV treatment may cost US $800 annually. Since it is one-off intervention, male circumcision is the most cost-effective at US $300 to avert one infection. The discounted benefit treatment costs averted for example, are approximately 11 times greater than cost of VMMC. Impact and costing estimates suggest that scaling up VMMC to reach 80% coverage among males between 15 to 49 years old in the 14 priority countries by 2015 would entail performing 20.3 million circumcisions. Achieving and maintaining that level until 2025 would avert 3.4 million or 22% of new HIV infections through 2025. While the scale-up would cost a total of $1.5 billion US by 2015, it would result in net savings due to averted treatment and care costs amounting to $16.5 billion US. In Kenya, we have not only implemented male circumcision, an efficient intervention in its own right, but also ensured the intervention itself is delivered efficiently. In our setting, 60% of the key inputs of male circumcision are human resources and in our settings, 60% of the key inputs of male circumcision are human resource and consumables. Like many other African countries, we continue to experience a considerable shortage of healthcare workers, and indeed there are only 14 doctors per 100,000 people. In 2009, we made a strategic decision to train nurses to offer male circumcision and to deploy them to implement the program. Not only are nurses as competent as doctors, but they offer tremendous value for money. Additionally, we know that nurses have always been in the forefront in delivering large-scale public health programs like HIV testing and counseling, maternal and child health services, including immunization and prevention of mother-child transmission of HIV services. I would like to urge other African nations to make the same move and ensure that even as donor funding declines, we will still be able to provide male circumcision services even with human resource constraints. One area that Kenya is considering to reduce the HIV/AIDS financing gap and avail sustainable resources for male circumcision is through universal health insurance. Several feasibility studies have indicated that the National Hospital Insurance Fund, that is MCHIP, would expand its benefit package to include the cost of male circumcision and the provision of ARVs. To finance the additional cost, the insurance premium would have to be increased, and the NHIF should be managed more efficiently, redirecting the reductions in management cost to cover increased outlays for AIDS benefits. Moreover, the NIF scheduled an ambitious increase in coverage incorporating much of the informal sector workers. All of these measures taken together would generate substantial additional funding for AIDS in the order of 7% of the financing gap in 2019-2020, increasing to 31% of the financing gap in 2029-2030. Is that?
Yes, we could let you finish and have no questions, or, I mean, what should we do?
Okay,
should we let him finish and there
I don't want to bore you with any more figures.
Okay.
So can we?
Are there questions? I'm sorry. Are there questions? Yes. If you could quickly come to the mic.
Thank you. Thank you for the presentation and the comments on the funding. I think one main concern is the approach that is currently being taken for male circumcision. A lot of it is occurring in the setting of projects that have a time span and a time limit. What are we doing as the different nations to ensure sustainability in our countries for this circumcision when all the funding from those projects is gone? Thank you.
Good question.
Well, I cannot speak for all the countries, but as a Minister of Finance, the surest way for our countries to make it, to make this process sustainable is to incorporate it in our own budgets, and incorporate it in our own budgets consistently and gradually, so that it doesn't become a shock. There are many competing needs, and therefore, if we do not give priority to the circumcision, which gives us efficiency of 60%, and incorporate it in our own budget, so that by the time the donor resources fizzle out, the funding shall be firmly in our own budget, then perhaps we shall not be doing justice to the requirement for us to use more cost-effective methods like the male circumcision, which is just a one-time off, and it gives an effectiveness of 60% prevention.
Thank you very much.